Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Each time on the show, we have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited today to have with me Dr. Julius Torelli. He is a cardiologist who transformed his practice over 4 decades into a holistic, prevention-focused approach to wellness. He integrates the non-physical dimensions of health into patient care, emphasizing personal responsibility and a mind-body approach to well-being. In 1999, he founded the Integrative Cardiology Center in North Carolina's Triad region, pioneering an integrative healthcare model. He recently launched Gratefully Well, a digital platform for holistic health education, and he is the author of Holistic Health Pathways, Awaken Vitality and Resilience with Intentional Gratitude, and the Gratefully Well Substack newsletter. So welcome, Dr. Torelli. How are you today?
Great, Diane. It's great to see you.
Yeah, you too.
Thank
We go
you.
way back, way back,
like probably 25 years.
I was going to say, for sure. Exactly. Yeah, when I was living in North Carolina, you were down there too. So, yeah, and I remember when I first met you, I was like, you're a what cardiologist?
A
What is
weirdo
an
cardiologist.
Yeah, what? No, I loved it because I was getting into all of the natural medicine and all that myself. And I was like, wow, there's actually a thing as an integrative cardiologist. So I want to just back up because I'm sure my listeners are like, we've never even heard of that before. Like a lot of the specialties in medicine, you don't really find people that are doing things from a more holistic or natural or integrative perspective. So what did something happen? Like what like shifted for you that you were like, I need to move the way that I practice towards this?
It was a sudden awakening. No, I'm joking. It was, it was a evolution really. And so it started, believe it or not, like the last week of medical school. So I don't believe in coincidence. I think everything happens for a reason. And I was doing a family practice rotation, and a woman came in, and I'll keep the story short, but it's actually going to be the first edition of the newsletter that we're putting out. We can talk more about that. But in that, this woman came in. She was in 38 or 40 years old. She had abdominal pain and vomiting and dry heaving for 3 days. She was real sick, dehydrated. And so we put her in the hospital, and we ran a bunch of tests. She was in for about 3 days, and we didn't find anything. All the tests were normal, and she was feeling a little bit better. And so when I went to discharge her, as I was sitting there trying to, fill out her discharge diagnoses and what have you, I was making small talk, and I, made some corny statement that, we can get you home so you can get some real rest because you can't get any rest in the hospital. And she said, I wish. And I thought that was a weird response. I said, what do you mean you wish? She says, I wish I could go home and get some rest. And I said, well, why can't you? And she says, well, she said, in the last 6 weeks, my husband left me, my house burned down, and my dog died.
Wow.
And I was sitting down, fortunately, because I thought I may have fallen. I had this sudden intuitive awareness that, well, that's what was causing your symptoms. Like that just seemed intuitively obvious to me. And so that was the first thought. And then the second thought was, wait a minute. This was Wednesday of the last week of medical school. I was going to graduate Thursday the next day. I said, I've completed medical school. I've completed my curriculum, and I don't know what this is. Like it seems obvious, but like I didn't learn anything about this. Is this really something? Okay, and if it is something, how do you treat it? because you got to know what it is and you have to have a name for it. You're going to treat it. And
Right.
I was like, I have this whole access to a whole medical school library, and I'm not even sure where to go and read about this. And so I was very, I don't know, I'll say confused. And there wasn't really anyone to talk to about that. And any discussions you might bring up with a physician, it's sort of not really looked at or or favored.
Considered. Yeah.
Yeah, it's really
Like,
it's not considered. Yeah.
yeah.
And so it's and that stayed with me. So I got very busy. Obviously, I had to move up to Cleveland. I was trained at the Cleveland Clinic, and then while I was there 6 years doing internal medicine and then cardiology, and it was a high volume place. So I saw a lot of patients who came in, and this always stayed in my mind. And so that was probably the very first thing. And then as I finished my training and I went into practice, over the next whatever 10 to 15 years, I found that most of the people that come in to see physicians, with it doesn't matter who they're seeing, what specialty, doesn't matter what the symptoms are, most of the time we don't find anything physical. So in Western medicine, we concentrate, let's say virtually 100% of the time on the physical, right? So so we look to find something physical. And if we find something, we're really good in Western medicine. Like if you got a broken bone,
Mm.
we pin it or we set it, it works well, right? If you've got belly pain, you've got appendicitis, we can cut it out and it works. If you're having chest pain and a heart attack, we can open the artery up and that works. If you have a tumor that can be cut out, that works. And that works. Maybe we find something physical. Let's call it 20% of the time, but it's not much more than that. So 70, 80% of the time, we don't find anything physical, and we call those medically unexplained symptoms. And the classic ones are like headache, like migraines especially, and belly pain, irritable bowel syndrome, right? Those can be very debilitating conditions, right? You go in to see your physician and you've got headaches. He may do an MRI. The MRI looks okay 99.9% of the time. And then he calls these migraine headaches, right?
Mm.
And so you're like, and he knows inherently, we all know as a society that headaches are associated with, emotional issues. People call it stress. I don't use the term stress too much because it's kind of non-specific. It means different things to different people and different professions. So, but I use, emotional um, instead. But regardless, you go in, you might be a 40-year-old female, right? You've got a 10 and a 13-year-old at home. You're working, you're busy. Maybe your husband drinks too much or something, and you have this stress. And you go in, you're having headaches. The physician sees you, and he may, give you a medicine to prevent migraines, right? And then another medicine, like, oh, in case you get the migraine on this medicine, here's one to treat the migraine. And then you're probably not sleeping well too, so we're going to give you something to help you sleep. And you may be a little depressed. We all have a Prozac deficiency in our society, and so we'll give you something for depression, and maybe something for anxiety too, a sedative. So the next thing you know, you're on somewhere between 3 and 5 medicines, and that might that might all be okay, but it's still not treating the foundational issue, which
Right.
is emotional, right? And so I would say, yeah, and so in this method that we sort of look at in the Gratefully Well, we don't throw the baby out with the bathwater. So we don't sort of say, a lot of integrative practitioners, alternative practitioners, especially physicians who go from allopathic Western medicine to functional medicine or alternative medicine, they say, oh, all Western medicine is bad, right? And so don't take the medicines, don't take the prescriptions, don't take the chemotherapy, don't have the surgery. Instead, do these other things. And this is more sort of integrates what I call the non-physical dimensions of health into the physical or into the Western medicine. So if you need chemotherapy or if you need surgery, that's fine. But let's also look at these non-physical dimensions of health, like the emotional, the behavioral, the mental health issues, the cultural issues, the social dimensions, and things like that. So all that over time, became what is now I think of as gratefully well.
Yeah. I want to just pop back to something that you said. So correct the percentages that you said, but it sounded like only 20% of every person that comes into the hospital with some sort of whatever symptom is actually has something that physically you can find on a test.
Yeah, so I would, the hospital may be a little bit, the numbers may be a
Well,
little
maybe
bit
like a
skewed.
regular
But
doctor's
yeah, so
office.
if
Yeah,
you combine all of the visits, whether they're ER visits, hospital visits, or office visits,
gotcha.
but certainly office visits for sure are mostly um, we don't find anything physical. So when people come in with the most common complaints are headaches, neck ache, chest pain, palpitations, belly ache, backache, fatigue. Most of the time we don't find anything, and then but we give names for all those things, right? We don't find anything physical, so it's either migraine headaches or tension headaches or cluster headaches or tension headaches with a migrainous component or something, you know um, mitral valve prolapse syndrome or chest pain or palpitations, belly pain. Turns out we call that irritable bowel syndrome. If you're tired all the time, we call that chronic fatigue. If you're aching all over, fibromyalgia. So we give these things, fancy names, because once you give a name, then we can, treat it. The
Yep,
problem with the treatment is if you look at the Western physician's toolbox, right, to fix things, if you open that toolbox up, the first tray that's in there are procedures, surgeries and things like that. And if you don't need surgery, you take out that tray, and then the rest of the toolbox is really only pharmaceutical.
right,
And so that's when and physicians want to help. So the woman, to go back to the woman with the headache, he wants to help. He's also only got 10 minutes to spend. He's
mm,
not going to ask her, how are things in your life, right?
right,
Instead, it's just easier. Pharmaceutical medicine is just very easy to say, hey, we're going to give you this medicine, this medicine, this medicine. I'll see you in 6 weeks and see how you're doing.
right. Yeah,
But the great
that's
majority,
amazing.
yeah, it's
Yep, yep, that's really amazing. So that tells me that like a lot of, what we're going to talk about a lot of this. We're going to go to break in a minute, but is that a lot of these symptoms and whatever, things people are feeling, it's really coming down to an emotional, probably an underlying emotional issue if you can't find anything physical.
Yes, I
So,
think so. And even if
yep,
you have something real, right,
yep,
like you have bypass surgery, there's still an emotional component to that I think
of
needs to be
course.
dealt with,
Yeah.
right?
Yep. Yep. Awesome. I love it. We're going to get into a lot more. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break. When we come back, we'll be exploring more with Dr. Julius Torelli. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. Before we continue, I want to make sure everyone knows how to contact me. You can reach out to me at www.drdianehayden.com or at either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Julius Torelli at www.gratefully.com. That's spelled GratefullyWell.com. So we were just talking about before we went to break how a lot of people's symptoms might have an emotional component to it. And one of the things you mentioned was just, if that's the case, you're seeing a lot of, we're seeing a lot of people coming into office visits or into the hospital with something that we can't find a physical reason for, and it's an emotional thing. How does this model of medicine that we have really work when a doctor only has 10 minutes to spend with you? Like, how can you get to the root of anything?
Yeah, that's I think a big problem and an issue that we're seeing in the current model of healthcare. When you look at the healthcare, the way it's gone over the last, let's call it 50 years or so, the technology is like advancing at a rapid pace. If you would have told me 30 years ago when I came out into practice that you could replace an aortic valve with a needle stick, I would have told you that's crazy. But yet today, we can do that. And the problem, though, I think, is that actually healthcare has actually deteriorated for a bunch of reasons, despite the technology. And so, in our current system, it's a fee-for-service system, right? It's an illness-based model, and I think that's ultimately the the root of the problem, right? In other words, people have to get sick for you to go see a doctor, and the doctor's livelihood depends on a patient getting sick. There's no
And
incentive.
staying sick, maybe.
Well, the longer they stay
Yeah.
sick, the better,
Yeah.
right? So because then they come back, and then it's a fee for service. So that's if you see them, you get paid. If you admit them to the hospital, you get paid. If you do tests on them, you get paid. If you do procedures on them, you get paid, right? And so there's no incentive really to keep a patient well,
Right.
and that I think ultimately is an issue because it also leads to studies not being done that need to be done on prevention because there's no financial incentive to do those studies, right? It might cost tens to even hundreds of millions of dollars to do a study like a cholesterol study, for example. But even if you spend $100 million doing it, there may be $1 billion drug, so there's a huge return on that investment, right?
Yep.
Um, Whereas in prevention, not so much. So that I think leads to a lot of problems. Plus the fact that, as you suggested, doctors are seeing patients in less time then, and we like to adhere to scientific principles, right? And the problem
Yep.
with that is that the scientific principles are things like you can measure, right? So like blood pressure or sugar, like glucose or cholesterol. And so we just focus on those things. And as you know, the psychosocial sort of studies, like on emotions or behavior, are much more difficult to do. They're much softer, right? The data
Mm.
is much softer. And so we don't do those studies, right? It's just easier to say, oh, look, blood pressure's high. That's bad, right? We did a study and showed that people with high blood pressure do worse. So we got this medicine. You treat the blood pressure, people do better, and you stop there. But no one ever goes to the foundation of why is the blood
Why?
pressure up to begin with,
Yeah.
right? And that's a great model for the pharmaceutical industry, right?
Sure.
Because then you have to stay on that, buy that medicine every month, stay on it for the rest of your life, right?
Yep.
And so I think that ultimately is a huge issue for us. So I think in the Gratefully Well method, it's really more what we like to think of as a wellness-based model. Again, focusing on prevention and wellness. How do you do that? Well, I always say it's easier to cure an illness if you never get it in the first place, right?
Hmm.
It's also less expensive to cure an illness if you never get it in the first place. And so, um, but then again, we know very little about prevention. So, so those are some of the challenges.
Yeah. So that kind of leads to one of the things I wanted to ask you. You open your introduction to your new book with the sentence, "The heart holds secrets no stethoscope can detect," which I love that. It's like, wow, that makes you think right there, right? Like that to me, like that one sentence, "The heart holds secrets that, modern medicine can't detect." So what, like, tell me, I guess, just what do you mean by that? I mean, I have a general understanding, but in your words, like, what did you mean by that?
Well, first, I'm thrilled that caught your eye or your ear or your heart. Um, and so that, because that wasn't in there originally, and I sort of put it in at the end because I just felt that it needed it. And so
Yeah.
I'm glad and it goes back to, again, when you look at a lot of patients over, time, and that one, is specific to the heart, mostly because I'm a cardiologist, but it really doesn't matter. Again, it goes back to this emphasis that these are if in fact we even have physical signs. We do know there's a syndrome called Takotsubo's cardiomyopathy, which is it's called broken heart syndrome. So it's usually in women, it's usually in mothers where there's a devastating event, like usually to a child, and and it's just tremendous grief, and their heart actually gets weak. And it's a known thing, right? And so
That was literally one of my questions to you. Do you
yeah,
believe a broken heart can cause physical changes?
yeah. So yeah, well, there you go. It absolutely, we know that. That's like accepted. That's in the literature. We talk about how to treat it and all this, but that's and again, if you go back and you think about, and one of the things that we talk about in Grateful Well a lot is about thoughts, about mindset, about beliefs. Think about a thought, right? If you're laying in bed, you're falling asleep, it's the middle of the night or whatever, and you hear a noise downstairs, and you think someone broke in. Maybe you're home alone. Okay, so what happens, right? Your heart starts racing, your palms
Mhm.
get sweaty, your blood pressure goes up. Believe it or not, your sugar goes up as well, right? And so you're like, and maybe you get the nerve to get out of bed. You go look downstairs, and you find like a broom fell in the kitchen or something like that. And
Mhm.
you go, oh, that was a sound. Okay.
Right.
And then you go back to bed, and now it's going to take you a while before your heart relaxes and you can relax and get back to sleep. So what happened there? No one broke in,
Right. You
but
created
yet
the
the
whole
fifth,
scenario.
exactly. So that
Yep.
that how powerful that thought was to create that physiology, that change in physiology. Nothing happened but a thought, right? And so we understand these things, but we don't talk about them much, right? We don't talk about much about placebo effects and about thoughts and how incredible mindset is and things like that. And so we try to emphasize that a lot. And so the if you take an emotion, and that's a simple thought, like, oh, someone, a broom fell in my kitchen or whatever, you thought someone broke in. But imagine if you have a tremendous amount of grief over, the death of a child or something like that. You can imagine then what kind of physiologic effect that would have. And different emotions, this is interesting. They don't teach you this in medical school. Different emotions get put in different places. I don't know how it works, but body
Oh, you mean
workers will
like
tell you.
different parts of the body or?
Yeah. So,
Okay.
body workers, massage therapists and kinesiologists and physical therapists, people who work on the body can tell you this. Like in the case of like the mother with the grief of the child, that's a heartfelt emotion, right? It
Mhm.
gets put in the chest. Whereas if you're stressed at work, it's usually like in your neck and back of your head, right? It's not generally like chest pain or whatever, right?
Mhm.
So different emotions tend to get stored in different places of the body.
Wow, that's fascinating. So I think one of the things I want to get into is you know how you work as a cardiologist, meaning like, so I know so many people. I don't know if this is a thing. Maybe you could even speak to this right now, but I know so many people, men and women, more so women, that are suffering with what they've been diagnosed with as either like PVCs, benign PVCs, some sort of like not AFib, but like an
Mhm.
irregular heart rate,
Yep.
whatever, arrhythmia. And there's no solution for them, like other than maybe they might want to put them on a beta blocker or some type of, or they tell you have anxiety or whatever. So how do you treat that as, or how would an integrative cardiologist work with someone like that?
Well, the first thing to understand is there's a reason why they don't treat it with any medicine. And the reason for that is because we used to treat it with medicine. So we have antiarrhythmic drugs that we used to use for PVC. This is going back now in the late 80s, maybe the early 90s. And we found out that the people who took the drugs died more frequently than the people who didn't because the drugs have a side effect that can make the rhythm
Jeez.
worse. And
Great.
so, but we were doing that for years.
Yeah.
And so after that, they stopped treating them. They basically said these arrhythmias are benign. Don't treat them. Well, that's fine to say. Don't Great, you're not treating it, but it can be again very debilitating or devastating to some people who just drives them crazy, right?
Yep.
And so again, these tend to have some kind of emotional basis. Sometimes they have a nutritional basis as well, I found, but I'll tell you about one of them. But one, just um, uh, going in and starting to assess, talking to a patient about, um, self-awareness and self-acceptance. What's going on at home? What are the emotional sort of issues? What are they dealing with? It's a form of counseling, and so when I was in practice, you came in and you got, if you had chest pain or palpitations, the first thing you got was a standard Western cardiology evaluation, right? You got an EKG and probably an echocardiogram, maybe a stress test, just to make sure you didn't have unstable angina or heart attack or whatever it was.
Hmm.
But again, 80 or 90%, I would say in my practice, it was more than 90% of the time I didn't find that, right? And so then we would start to look in, okay, what is going on in your life, right? And when you ask that question, or start to approach it that way, now it's not going to take 10 minutes. It's going to take a lot more. And so there has to be sort of, a whatever, a dedication toward doing that, or having, we used to have counselors also in our office and things like that, and we would most of the patients got referred for some kind of counseling as well. Not, maybe talk therapy, but there are a lot of other techniques now, like CBT, like EMDR, like TFTs and EFTs and stuff that people can do as well.
Yeah. Yeah. I think that's the thing. It's like getting to the cause. Again, we're talking about getting to the root cause of why this is happening instead of just trying to fix a symptom. So we're
Yeah.
going to get into a lot more. You're listening to the Dr. Diane Show. We're going to take a quick break and we will be back. Stay tuned with Dr. Julius Torelli. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. I am talking today with Dr. Julius Torelli. He's an integrative cardiologist, and you can learn more about him at www.gratefullywell.com. That's spelled GRATEFULLYWELL.com. So right before we left, we were just talking about, and this was, I wanted to circle back to this because the one thing I wanted to ask you, if you have an opinion, is, why do you think we're seeing so many people with these like irregular heart rhythms? And is it just because our society has become so overstressed and anxious? And that, I mean, do you think that it's that, or is there anything else that you have put your finger on?
Yeah, I mean, I think it's an overall sort of, let's call it busyness, right? I think we are, less focused on, we don't, as a culture in the West, right? We don't do a lot of inward reflection, right? So we started doing mindfulness, for example, back in the late 90s. It was like new back then.
Mhm.
It's catching on now, and a lot more people, even executives and stuff, meditate and they look at mindfulness. That's good, but it's still a very small percentage of the population. And so we just don't spend a lot of time. I don't want to call it relaxing. I just sort of say taking care of ourselves, right? From an
Yeah.
emotional sort of standpoint.
Yep. So I want to start talking about your new book and this new platform that you have. And there's another part of your book that stood out for me that I love. You tell the story about how you really were, I guess, at a place in your life where you felt like you needed to be more grateful for things. So you were trying to practice gratitude and having a journal and that, but it kind of wasn't like, it just wasn't clicking for you. And all of a sudden you walk into this grocery store and you felt like this amazing gratitude for a tomato.
Yeah.
And I
Yeah.
love that.
Yeah.
I can
Yeah.
just see you.
Oh, well, so when I was developing this method, let's call it, right back then, I called it the personal awareness program, but the acronym didn't work that well, and so I kind of changed it. But in that program, I found in the literature that there's literature on gratitude and the benefits of
Mhm.
gratitude. There's health, physical and mental health benefits of gratitude, and the book is, there's a lot of books on gratitude. The book was really meant to focus specifically on that. And so there's a very dry chapter in there, chapter 2, which you probably liked, but it's very scientific, right? And it's just goes over again the physiology of gratitude, that these thoughts can change physiology, and it changes hormone and neurotransmitter levels in the brain and the body and things like that. So I saw that, right, that there's this literature on gratitude, and I started to implement that in this personal awareness program, and people liked it, right? And so I was doing it, but I was still struggling with it because it was challenging to do. You have to sit down every day and journal, whatever. At that time, my wife had breast cancer, had been diagnosed with breast cancer, and it was just a stressful time. And I just remember I was driving home, and well, let me go back. So the issue is, everyone talks about the gratitude journal. Write down 3 things you're grateful for every day and things like that. And for some people that just sort of doesn't cut it. And the reason is because, and this is what's hard to do in these studies. These studies are hard to do, is that the gratitude really has to be authentic, or what I call awe-inspiring gratitude, right? And so if you just, you're going to sleep and you go, oh, I forgot to write my 3 things down, and you get up and you go, oh, I'm grateful for my family and I'm grateful for, whatever. Maybe that has an effect, but it's not going to be all that great. And so the the book was, I came up with this term I call intentional gratitude, which is basically trying to amplify the gratitude. And where that really came from was this episode where it was a Friday night, and no one goes. I like go to the grocery store on Friday. I like to cook. I like to go to the grocery store, and no one's in the grocery store Friday nights. They're all out having a good time. So
Right.
I'm the only weirdo there. So I walk into the produce section, which is usually the first section you walk into, and I was just literally overwhelmed with this I call it awe-inspiring gratitude, right? It was just, I became suddenly aware as I'm sort of sitting there looking at this tomato that what it takes not only to get that tomato to the store, right? But the fact that I didn't have to go out and, plant, till the soil, plant the seed, take care of the plant, wait for it to grow, and then, pick the tomato and then, take care of it and then cut it up or whatever. I could just buy this tomato. It was there, right? And it was all available to me, right? And then the real also awe-inspiring gratitude was the bread section.
Right.
Because it's
Because
like,
everybody loves bread.
well, everyone likes bread, and there's like 100 different things that to
Breads.
pick from. You
Yeah.
think of all the different bread, and I'm like, wait a minute. Again, I didn't have to like, till the soil, plant the wheat, and grow the wheat, and mill, harvest the wheat, and mill the wheat, and make the flour, and then so I didn't have to do any of that. But even bigger than that was, what does it take, the resources to get that loaf of bread on the store shelf so you can buy it? If you think about all of the resources necessary, again, all the way from growing the wheat to getting then the wheat to the mill to harvest, and someone's got to take all that harvested, the milled wheat and turn it into flour. They got to take the flour to another place, to get packaged or whatever, and then someone's got to deliver that flour to a baker. The baker's got to, have a facility where they manufacture the bread or bake the bread. They got to package it, right? And then they got to have trucks. And think about all the trucks. What do you need to, the trucks, the resources on the trucks? You need gas, you need tires, right?
It's
And
amazing we get any food at all.
and amazing that a loaf of bread doesn't cost $100,
Yeah. Right.
right? And so it was just, I was like, oh my gosh, this is like it, and we take that for granted, right? And
Well,
we just
so
kind of, yeah.
did you walk into the store thinking about what you could be grateful for? Or were you not thinking about that at all? And this was just sort of like a flash of enlightenment? Like
Well,
I bet people are listening to this thinking, well, how can I feel that way? Like, how did that happen for him?
so it happened spontaneously for me. However, what I that's what the intentional gratitude is, right? And so it is taking whatever it is that you're, rather than writing three things down in your gratitude journal, which you can absolutely do and is effective. I'm not saying not to do it, but intentional gratitude is like you could be sitting right in your car stuck in traffic, right, on a hot summer day, and you're like you have a choice. Here's that goes back to that perception and choice. You have a choice, and you could say, you know, I should have left earlier. You can beat yourself up, right? Like, why didn't I
Yep.
leave early? What's wrong? Why do I always leave late, right? And you right, and then why is there all this traffic or whatever, right? And what's happening during that time, right? Your blood pressure is going up, your heart rate's going up, your sugar's going up, your cortisol is going up, right? All of these, and those are all bad things that are happening, right? And you sit there and you say, well, that's because of the traffic. Well, it's not because of the traffic. It's because of the way you're perceiving the traffic, right? So the intentional gratitude is like, okay, I'm sitting here. I don't have a journal and I don't need a journal, but I can find one thing to be grateful for, just one thing, right? Which might be, hey, it's 95 degrees out and I've got air conditioning and I'm not hot. And you just think that, and you can be very grateful for that. And so all of those hormones, all the, the epinephrine and norepinephrine that are all being secreted all kind of go down, right? And then you could say, I've been wanting to listen to this podcast, the Dr. Diane show. I forgot that episode. Or I wanted to listen to this music that I have been able to
Now I
listen.
have time.
Yeah, and now you can listen to that because you can't. The fact is, you're stuck in traffic, and you're not going to change that,
Right.
right?
Yep.
And so, but you can change your perception of it. And you might say, well, next time I'm going to leave earlier. But if you keep beating yourself up over it, you're causing yourself harm. You're doing it to yourself, right? Where you can just look at this and find another way to look at it. And then you can, again, you can sit there with your car and say, oh, I got air conditioning, thank God. But, what about this car starts every morning, right? And I can drive it and it's got, I appreciate the tires and I appreciate the people who put the car together, the people who made the steel for the car, the people who delivered the steel to make the car, and the people who made the truck to deliver the steel to make the car, the people who grew the food to feed the guy who drove the truck. You know what I mean?
Right.
And so you can take it as far as you want. And so that's what I call intentional gratitude, or just amplifying that gratitude to where it becomes awe-inspiring, trying to recreate what happened to me in the grocery store.
Yeah, and I think that the more you go down that path, the more you become more and more grateful, because now you're
Yes.
opening up all these new ideas as to, wow, like how amazing is this really, that this can even happen, that I can have any of these choices of bread. And like you said, that they don't cost $100. I mean, that's the whole thing. And it really does come down to the power of the mind.
Yes.
Because I mean, I could tell you so many stories, and I have, and you know this because I've talked to you about this, but even a personal story that I've had with my own, irregular heart rate and tachycardia and that kind of thing. And I finally got to a place where I was like, okay, like not being able to figure out what it was bothering me so much that it was making it worse, because I wanted to know like an answer for it, like why is this happening to
Yeah.
me, which I think a lot of people do want to know.
Yep.
And what I would recommend to everybody, I went to a cardiologist, I had the EKG, looked at all these different things, of
Yeah.
course, no, there's
You want
can't
to make
find
sure you
anything.
want to make sure nothing's going on.
Oh,
Sure.
of course,
Yeah.
exactly, right. um and left with like, like, well, just go home and calm down. Okay, great, until it happens again. And I couldn't put my finger on why it was happening. It generally was not happening when I was under stress. It was happening when I was relaxing. And like, what did I eat that day? What did I drink? Did I have enough electrolyte? All these things. And then when it's happening, and you're because I'm one of those people that can feel it. Like a lot of people I
Mhm.
think get these arrhythmias and they don't even feel it at all. Well, I can
Right. Right.
feel, you name it. Like I could tell you,
Right.
you could be doing my EKG, I could tell you exactly when it's happening.
Yep.
And that makes it worse for people
Yep.
like me, because I feel it. And I'm
Yep.
like, oh my God, what is my heart doing? Is it gonna, but every single time, like, it goes back to normal.
Yep.
And I have gotten myself out of tachycardia, like just by doing deep breathing
Yep.
and calming down and saying to myself, okay, like my body will figure this out. It's going to go back to normal. And it may be, I don't even think it's a minute, right? Like it seems like it's minutes that it's doing that, but it's probably not that long. But I
Yeah.
mean,
Yeah.
it,
The challenge is a lot of those issues, whatever they're emotional or what, are unconscious. And
right.
so it becomes very, like you said, I'm not stressed when it happens. Well, you may not be stressed consciously, right? But there may be some unconscious thing going on that might have nothing to do with, it may have something to do with other, what I'll call them self-worth issues, right? Or self-esteem issues, or not good enough issues, or shame issues, or whatever, that are very buried, that are not necessarily conscious. So it's not always easy to figure this out. But even if you don't figure it out, again, if you sort of do and focus on these, I don't know what to call them, I'll call them wellness principles, right? And so like with the Gratefully Well method, with the first thing is you got to have a willingness to take some degree of personal responsibility for your health care.
Mhm.
One of the problems in our society today is that we've placed all the responsibility for your healthcare on the physician, right? So when you're having those migraine headaches and he doesn't find a brain tumor, right? And he puts you on those 3 or 4 or 5 medicines, it's like, so then, you probably need also lose some weight. So we're going to put you on this medicine to help you lose weight. And then we've got this other medicine here, you seem a little bit depressed. We're going to put you in this medicine for depression. And we're going to put you on this, other medicine for your sugar, for your diabetes, because you're not willing, to become more active and lose weight and change your lifestyle. And again, all the doctor really has for the most part are pharmaceuticals. And so the next thing you know, it's not unusual for people to be on like 8 to 12 medicines, because they're not willing to take some degree of responsibility to change their lifestyle. And that's very common. Like, it's just,
Right.
doctor, just give me a pill.
Yep.
So if you're not willing to do that, and then like even this method's not going to work. Like, go, no judgment, go take the medicine. That's fine if that's what you choose to do. Um, but that doesn't work for most people.
Well,
And
I'm
then
the
the second,
opposite. I don't want to take any
yeah,
medication.
well, I know, but again, we and I'm the same way. But
Right.
we're for us as a society, most people are not like us, right? Most people are, doc, just fix this, just give me, so I can get back to my, normal
Life.
hectic
Yeah.
lifestyle, right?
Yeah.
And then the second thing is that choice thing, right? Perception is a choice, like we talked about in the car, right? That you have, most people want to choose the victim path, right?
Yeah.
I'm very good at doing that. And you have to recognize that. And we talk a lot about recognition, how you know you chose that victim path, and then how to get out of that and jump onto the non-victim path, or what I like to call the victor path. So there's a lot of self-awareness, self-acceptance principles in there. Some people would call that self-compassion. I don't like the term self-compassion personally, although Kristen Neff and Chris Germer have done a great job with, all their programs in self-compassion. I like to think of it more of as a self-awareness, self-acceptance sort of component. And then there's this mental health component. What's this reframing of, the thoughts, right? In CBT, you would call it cognitive restructuring. I like to just think of it as reframing. We use gratitude. Gratitude can like do it instantly, like get you out of, like in the car. It literally can work within seconds and change your physiology. And so it's just incredibly powerful, right? And then, as you were saying, the mindset. Again, I started with thoughts. That's how I used to talk about it. And then it kind of morphed into, evolved into beliefs. Beliefs had a little bit sometimes of a religious connotation. And so even though I love the biology of beliefs, Bruce Lipton stuff,
Hmm.
great book if anyone is interested. And then the mindset is in vogue now, that term. And I think as you've used it is important. And then within that mindset is like the placebo effect, right? So for people who don't know what that is, it's sugar pill effect. If you give people a sugar pill, on average, about 30% of the time, somewhere between about 15 and 40% of the time, patients will get better. They will improve.
Crazy.
It is craziness. When I first
Yep.
heard
That's
about
the
that,
power of the mind.
it's
That
all
right
the
there.
mind, right? And so, like,
Yep.
when I first heard about that, I was like, why aren't we doing like in Western medicine? We look
Studies
at it,
on that.
well, it's in Western medicine, we look at it as kind of a pain. Like it's like like we have to do studies to compare our drug to the sugar pill to show that it works better. And I'm like, why don't we try to amplify the placebo effect?
No kidding.
Yeah. And so
No, there's
then,
no money in that. So there you
well,
go.
that's the problem. And so then again, we sort of incorporate the gratitude. We use that a lot. And that's just about lifestyle, right? We like to talk about living an active lifestyle. So when you talk about exercise, a lot of patients will, bristle. So we just talk about how to live an active lifestyle. Like again, the busy mother with the two kids, she can go out and maybe do things with her kids that are active, whatever it is,
Right.
whether it's a bicycle or whether it's walk or, whatever. You don't have to be going to the gym and, lifting
No.
weights, although you can get to that, but you don't have to do that,
Do
right?
something you like.
Active, right? And then we talk about nutrition rather than weight loss and diet, and focus on the nutrition, and the weight loss and will follow. And then it's even like smoking. Like we don't talk about smoking cessation so much. We talk about more like smoking awareness. Like why are you smoking, as opposed to beating you up saying you shouldn't smoke. You shouldn't smoke. Why are you smoking? It's why are you smoking, and come to understand what it's doing. And then usually that's because it's a relaxation, because in fact, the best thing that ever happened to smokers when they stopped allowing smokers to smoke in office buildings, and they had to leave their desk. They had to go outside. There's usually a little patio or a nice area. They can
Yeah.
sit down and they can sit there. And if they're all alone, they have a 10-minute meditation, right? A 10-minute mindfulness session. And if there's people there, you now have a support group because you
Right.
have you have three or
That's
four or
so
10
true. I never
people, right?
thought about it like
Because
that.
you see in the
Yeah.
hospital all the time, you would see like the CFO, a nurse or
Mhm.
two, an orderly,
Oh
maybe
my
an
God.
assistant, people who would otherwise never get together, and they had one thing in common, and they would be sitting there smoking their cigarette. And I said, "It's a support group." Unfortunately, smokers when they quit, they lose that. So I tell people when they're quitting, don't every hour and a half, stop what you're doing and leave your desk and still do it, but don't go to the smoking area.
Right.
Yeah, go somewhere else
Right.
and go
Find
walk.
another support group,
Yeah, exactly.
like a
Exactly.
walking group or something.
Exactly.
So, what else, before we wrap up in a few minutes, what else do you want people to know? I mean, obviously they can go to your website, www.gratefullywell.com. The book, which I have right here, Holistic Health Pathways, they can get on Amazon, right?
Right. It's only on
Okay.
Amazon right now.
Okay, perfect. Any other things that you want to leave people with,
Yeah,
or ways to get in touch with you, or
I
things that
think
are coming up?
what I'd like people to know is this is brand new. The technique isn't new, the method isn't new, but this is what I used to do face to face with patients, right? And so, and I would address things that sort of needed to address as I was interacting with them. The Gratefully Well is a what I like to think of as a digital educational platform. And so there's going to be a lot of potential information on the platform. The platform is going to be a newsletter, which will be on Substack, which will be called Gratefully Well. There'll be there is a website already. The website right now is really just a landing page to get email addresses to send out the newsletter. There's a 7-day Gratefully Well or 7-day Great Gratitude Challenge on the website. If you want to do that, I encourage everyone to do that. On the Substack, there'll also be what I call daily gratitude bits, so you can get notifications for those. And those are basically just to show you that it just takes a minute, and that you could do it at any time, and that there'll be very short bits of information that you can be grateful for. And so that'll be on there. But then I'm also going to have a webinar. By the way, the newsletter's free. The webinar will be free, at least for now. And it's really going to be more information gathering. It'll be presenting the Gratefully Well method, how we do things. But there's no such thing as a free lunch. So what I'm expecting back is some feedback from
Hmm.
people as to what they liked, what they didn't like, and what content they would like to see. Because I don't want to create a ton of content that no one's interested in. I can write a bunch of stuff, but if they're not interested in it, that's not going to do anyone any good. So I want to see what resonates with people, what doesn't, and what they'd like to see more of. So yeah, go to gratefullywell.com. You can sign up for the 7-day gratitude challenge. Go to the Substack, the newsletter we call Gratefully Well. That'll go up next week.
Awesome. Yeah. I feel like we really just scratched the surface here. There's like so many. We're going to have to do another one because I mean, one of the things I wanted to talk about that you say in your book, and so maybe this will get people to reach out to you and sign up and learn more, is you actually worked with a patient who reversed heart failure. So
Yeah.
we don't have time to get into that right now, but I wanted to put that out there because I think that a lot of people, especially with issues around the heart,
Yeah.
I think people feel like there's no going back unless they have like some major surgery or they're on, well, most of the times with heart situations, that's the only thing, right? Like it's got to be like a major surgery. And I think that there are ways to reverse that, just like we have books out there about reversing cancer and all kinds of stuff like that. So
Yeah, the
it's
mind is
possible.
powerful. Yeah, it's definitely
Yeah.
possible, and but it's not talked about much, right? And if you talk about
Yeah.
heart failure to doctors, they want to make sure you got to be on GDMT, guideline-directed medical therapy, which is now I think 5 or 6 drugs, and you got to be on
Nice.
big doses of all of them. And it's like I'm not against the drugs, right?
Right.
But a lot of education, patients need the education, and in fee-for-service medicine, education is not reimbursed that well, so it's not done
Yeah.
very often. So
Right. Right. But it's possible.
it's very
So,
possible.
yeah. So thank you so much, Dr. Torelli. This has been a pleasure.
I've
Always,
enjoyed it. Thank you
always
for the
amazing.
invitation.
Of course. Yes, we'll definitely have you on again. And I want
Okay.
to thank all of you for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific. Next time, we'll be discussing more about the power of thoughts and beliefs and the impact they have on your life. Have a great week, and I'll see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.